Imagine an organ designed to produce powerful digestive enzymes, suddenly releasing that destructive power in the wrong place. Instead of helping your body break down food, those enzymes become active inside the pancreas itself. The result can be intense inflammation, severe abdominal pain, serious complications, and a condition known as pancreatitis. And here is what makes pancreatitis so important to understand. The signs can be easy to miss at first, but knowing what is happening inside the body can make the symptoms, laboratory findings, and treatment approach much easier to understand. In this video, we are going to follow the story of what happens when the pancreas can no longer safely control its own digestive enzymes, and why that can quickly become a medical emergency. The pancreas has two major roles in the body. First, it produces digestive enzymes that help break down the food you eat. These include enzymes involved in breaking down proteins, fats, and carbohydrates. Second, it has an endocrine function, producing hormones such as insulin and glucagon that help regulate blood glucose levels. Under normal circumstances, this system works with remarkable precision. Digestive enzymes are produced by the pancreas and travel through the pancreatic duct toward the intestine, where they can do their job. But when something disrupts that process, the situation can change dramatically. In pancreatitis, the pancreas becomes inflamed, often because its digestive enzymes become activated prematurely. Instead of remaining safely controlled until they reach their intended destination, they begin causing damage within the pancreas itself. You can think of these enzymes as powerful tools that are meant to work outside the organ. But if they activate too early, it is as if the pancreas has accidentally turned its own digestive machinery against itself. This process is known as autodigestion. And once that inflammation begins, a dangerous chain reaction can follow. One possible trigger is obstruction. If the pancreatic duct becomes blocked, digestive enzymes may have difficulty flowing normally into the intestine. A gallstone, for example, can move into an area where it interferes with the normal flow of pancreatic secretions. Long-term alcohol-related inflammation can also contribute to problems involving the pancreatic duct. Other causes described in the source material include gallbladder disease, cystic fibrosis, and trauma or inflammation associated with surgery or certain diagnostic procedures. One procedure worth remembering is ERCP, or endoscopic retrograde cholangiopancreatography. ERCP may be used to investigate or treat problems involving the bile and pancreatic ducts. But irritation or trauma to the area can contribute to inflammation. That means a patient who develops significant epigastric pain after an ERCP requires careful attention. Now imagine what the patient may feel as the inflammation develops. One of the most characteristic symptoms is significant pain in the upper abdominal region. The pain is often described around the epigastric or left upper quadrant area and may radiate toward the back. That detail matters. Abdominal pain can point to many different conditions, but the location and radiation of the pain can provide important clues. In pancreatitis, upper abdominal pain radiating to the back is a major feature to recognize. Other concerning findings may appear as the inflammation becomes more severe. The source material describes Gray-Turner sign as bruising or ecchymosis along the flanks and Cullen sign as bruising around the umbilical area. These findings can be associated with severe disease and bleeding. Jaundice may also develop, causing yellowing of the skin and eyes when the biliary system is affected. Hypotension and abdominal fluid accumulation may also occur in serious cases. But the story does not end with visible symptoms. Inside the body, laboratory changes can provide further evidence that the pancreas is under stress. Two important pancreatic enzymes are amylase and lipase. Both may be elevated, with lipase emphasized in the source material as particularly important when evaluating pancreatitis. Blood glucose can also become elevated because pancreatic dysfunction can interfere with insulin release and glucose regulation. This may require glucose monitoring and, in some situations, temporary insulin therapy. Other findings may include an elevated white blood cell count and fever, reflecting the body's inflammatory response. Changes involving bilirubin and coagulation studies may also occur when surrounding systems are affected. And this is where pancreatitis can become especially dangerous. Severe inflammation is not always limited to the pancreas. The inflammatory process can affect the entire body and lead to life-threatening complications. One of the most serious complications highlighted in the source material is acute respiratory distress syndrome, or ARDA. When widespread inflammation damages the body's blood vessels, fluid can leak into the lungs and interfere with oxygen exchange. Suddenly, a condition that began with abdominal pain can progress into a serious respiratory emergency. Another major concern is peritonitis, or inflammation involving the peritoneal cavity. Warning signs described in the source material include fever, rebound tenderness, and a rigid or board-like abdomen. Increasing abdominal pain and tenderness, restlessness, rapid heart rate, and rapid breathing may also signal serious deterioration and require urgent medical evaluation. So, what happens when a patient is diagnosed with acute pancreatitis? One of the key goals is to reduce stimulation of the pancreas. The source material describes keeping the patient NPO initially, meaning no food or oral intake for a period of time because eating and drinking can stimulate pancreatic activity. An NG tube may also be used in certain situations for gastric decompression. Pain management and IV fluids are also important components of care described in the source material. Blood glucose should be monitored because pancreatic dysfunction can affect insulin production and blood sugar levels. As recovery progresses, nutrition becomes another important part of the story. The source material emphasizes a bland diet that is low in fat and low in sugar. The reasoning is straightforward. Reducing dietary demands can help limit the burden placed on a recovering pancreas. That means heavily fried and high-fat foods may not be ideal choices during recovery, while lower-fat options such as grilled foods and reduced fat choices may be more appropriate within the dietary plan recommended by the healthcare team. Pancreatic enzymes may also be used with meals when prescribed. The most important lesson is to understand the pattern. Pancreatitis is not simply stomach pain. It is inflammation of a vital organ whose normal job involves producing powerful digestive enzymes and regulating blood glucose. When those enzymes become activated prematurely, the pancreas can essentially begin digesting itself. From there, inflammation can escalate, ducts can become obstructed, severe pain can develop, laboratory values can change, and complications can affect organs far beyond the abdomen. Remember the key warning pattern? Severe upper abdominal or epigastric pain that may radiate to the back, elevated pancreatic enzymes, possible glucose abnormalities, and signs of worsening inflammation or systemic complications. And perhaps the most important point of all is this: severe abdominal pain should never be ignored. Pancreatitis can range from a serious inflammatory condition to a potentially life-threatening emergency, particularly when complications such as ARDS, internal bleeding, or peritonitis develop. If you found this explanation helpful, subscribe to Auralith Wellness for more clear, engaging, and easy-to-understand videos about health, wellness, and the remarkable ways the human body works. Because sometimes understanding what is happening inside the body is the first step toward recognizing why the warning signs matter.